of the disease. Is it?
Yes, ma'am.
Okay, very good. Can anyone, roll number 81, can you tell me what is the definition of pharmacology? 81?
Ma'am, yeah, ma'am, pharmacology means the word is derived from a Greek word. Pharmakon means, I think so, drug, and logos means discourse in it.
So can you
to
expand?
Ma'am, it means the study of drugs or medicine.
Okay. See, I asked to Rutam that pharmacotherapeutics definition, and I ask you pharmacology. Okay. There is
Yes,
some difference in these two definitions. Can anyone explain me? Because Rushil said that it is a drug therapy, and Rutam said it is a therapy of disease.
Ma'am,
yes.
ma'am, in pharmacotherapeutics, ma'am, it is a definition in which the person has a particular disease, and it is a branch to know that particular disease for its prevention.
Very
that
good.
is pharmacotherapeutics.
Okay, very good. So I think I'm happy that students have interacted and they have taken initiative. So congratulations to them. It is my first class and I'm happy. Everyone, you should take participations in interactions, right? Then only it will be interesting. Chalo. So today's system, I will start with the general pharmacology, where the first topic of general pharmacology, which I am going to cover today, that is sources of drug and routes of drug administration. Okay, so this is the first class, and the title of this class is sources of drug and route of drug administration. Yesterday, faculty told about the competencies. You all know that competencies NMC has already decided the syllabus of pharmacology in terms of competencies. So there are 64 competencies which you all have to come across in theory classes, which is divided in different systems. In general pharmacology, today I'm going to discuss these first three competencies, and next class will be the last competencies. So which are the competencies which are related with this general pharmacology, which is decided by the experts? So the first is the first competency is define and describe the principles of pharmacology and pharmacotherapeutics, right? Definitions we have discussed. The second competency, that is describe the basis of, remember the term evidence-based medicine and therapeutic drug monitoring. The third competency which relate with this system, that is enumerate and identify drug formulations and drug delivery systems. And the other competencies which I'm going to describe some of the aspect today, and then next classes onward. So that competency is describe various routes of drug administration. They are oral, subcutaneous, intravenous, intramuscular, and sublingual. So now you can observe here that there are some of the adjectives which is used here. That is, you can say the describe, then enumerate, identify. So these are the terms that are very important while you are writing in your theory paper. Okay, when it is a define, means you know that there is a scientific definition is available. So you have to define, that may be of your short answer question. When we ask you describe, means you know that describe could be of, I mean in lengthwise it is more than short answer questions. So these type of questions can be asked in your short notes. Enumerate means the other word could be of enlist. So you have to write down or mention. So these are the terms where if suppose we use, that means the number 1, 2, 3, 4, enumerate the drug delivery system, or maybe the enlist. And descriptions, again, that is a short answer, I mean the short notes. Okay. So from these competencies, of course, we do ask the questions of long answer questions. I will tell you that how, I mean, what type of that questions. So could be from of long answer questions, could be of short notes, and could be of short answer questions. Okay. So as you come across that general pharmacology weightage is more, it is there, and it will be asked in all the exam. Coming to the today's class specific objectives. So what are the objectives we all, I mean, you all should able to do? That is, you should able to describe various sources of drugs. That is the first objective which I am going to discuss here. Then enlist. Now you can say the term here, it is a different. Enlist different route of drug administration. Describe factors which determines route of drug administration, right? There are certain factors which determines that by which route you should administer the drugs. Then describe advantages and disadvantages of each individual route of drug administration. Very, very, very important objective. Demonstrate how to administer drug through various routes and communication with the patient. So now this is the objective of the general pharmacology of first three competencies. But you can see that last two objectives, that is demonstrate and communicate, that is only possible when you come offline or there is a physical presence. So these two comes under the skill part. Okay, you know there are three domains: knowledge, skill, and attitude. So this demonstration comes under the skills, means you have to do something hands-on. And communications, which deals with the attitude, that is also you have to demonstrate when once you come physically. So first four objectives, they are comes under your knowledge, where you have to synthesize, we have to apply your knowledge, and that can be asked in your theory. Fine. So now pharmacology, I have discussed that it is a science which deals with filling the blanks. Is what? Study of the drug. And anyone can fill the next blank, because somebody said science deals with study of drug, and anyone would like to fill this blank? You can read it. It is there in a book, must be there in front of you. Anyone? Who wants to tell me? Who wants to fill? Yes, very good. Interaction, right? Physiological and biochemical what? Actions of drugs. Okay. See, very good. Mechanism. Yes, very good. Physiological and biochemical mechanism, action of drug, and interaction. So you can expand. It is the science deals with the study of drug and drug interactions with living system. Okay. Now, see, there are historical aspects. You all know that there is some a birth of these medicine. What is that? In ancient time, the religion and the treatment of disease has some collaboration. You all know that several cultures like Chinese, Greek, India, Roman, Persian, European, and so on, they contributed in the development of medicine. You all know there are some histories lying behind the development of medicine. Drug prescriptions included prescriptions from herbs, animals, and minerals. They have some relations with the culture. I'm talking about the ancient time. Okay. You know that Indians' earliest pharmacological writing, they are from Vedas. Remember, pharmacological writing, it is discovered from the Vedas. Rig Veda, what is Rig Veda? It is a description of some medicine. Now we say that what is the mechanism of particular medicine? What is the pharmacological basis? What is the pharmacological action? So this all relate with the Rig Veda, the Rig Veda, that is in the past, ancient time. Then there is a one scientist, that is, the name is Pan Sao. Chinese Material Medica was written by him. Okay, Material Medica was written, and then Greek studied the toxic effect of plant extract. Now we all will discuss in future that what are the toxic effects or the adverse effects of drugs. Okay, but it was already happened in ancient time, and that was studied by the Greek. So there are some, I mean, the cultures, it has its contribution. You all know that Hippocrates' contributions, he studied the causes of disease and he wrote on the ethics of medicine. And he only recommended that there should be a judicious use of drugs. And grandfather of pharmacology, you know, who is he? Who was he? He was a Paracelsus. He was born in Switzerland, and he was the son of physician. And he, I mean, he's known as a grandfather of pharmacology. And he wrote that all drugs are poisonous. Okay, so one has to use the drug judiciously. So there is a one saying which is written by him, that is, all drugs are poisonous, and it is only the dose which makes a thing poison. So here you correlate your knowledge about the term yesterday must have discussed, that is rational drug therapy. What is rational drug therapy? And even what is rational meaning of rational related with the pharmacology or drug? Anyone? See, it is written here that all drugs are poison, only the dose matter. So what is the rationality? Anyone? Rational means all, let me give you clue. Rational means all rights, R-I-G-H-T. If I would say what is rational drug therapy, so would anyone like to write here? Other students, please unmute everyone, because there's some noise going on. Can anyone tell me? Write your number, I will ask you. What is rational drug therapy? Srusti, you have written something scientifically proven. 93 roll number. Srusti, can you unmute your? Yes. Would you like to say something about rational drug therapy?
Yes, ma'am. It is a scientifically proven means जिसमें मतलब कि वो prove है और
yes, हाँ, proven है. Okay, then means authentic है, right? Anything else? Anyone? Otherwise, I will ask roll number wise. Shall I? So I could say that they are, I mean, I could see they are present or not. Roll number 11 is there? Roll number 11, can you give your presence here?
Yes, ma'am.
Yes, can you tell me what is your name?
Yes, ma'am. Bansri Sonnagara.
Bansri, can you tell me rational means what? See, there is again, when you interact, if you are comfortable in Hindi, Gujarati, I am fine. But your concept should be clear.
Yeah, ma'am.
What is rational means?
Yeah, she said was like scientifically proven. मतलब कि जो हम ले सकते हैं.
Okay, fine. Let me tell you. What is rational means right? Suppose if I would say that rational drug therapy means the right drug in a right dose, in a right manner. Manner means you have to decide that by which route it is applicable. Then it should be without side effect, and it should be in a cost-effective manner. So rational, why I'm telling you here, there is some correlations of these quote which I'm telling you, that doses matter. Okay, you have when you are prescribing the drugs, it should be in a right dose. It should be right drug, means the appropriate drug, and it should be in a correct manner. Okay, so that is the thing here which I would like to tell you. With the growth of science and scientific methods, there is a birth of modern medicine, because now you know that every here and there is a me too drug, like new drug development is there. And for that, the term which is very important is evidence based medicine. Why this concept is necessary? As I told you, there is a rapid growth of new drug, as well as there is a rapid growth of new disease also. And we all are the witness of this for last 2 years. We never knew that these type of pandemic will occur and will have a crisis. Which drug is applicable? Which drug is effective? And then there is evidence-based medicine, there is a trials, and we can come into some conclusion. So evidence-based medicine's concept is also very important. What is evidence-based medicine means? It is a based evidence that can be found in medical literature. You know, there are so many medical literatures. Now we have social media, and it is approachable for everyone. There are so many journals available, so many books are there. So based evidence that can be found in medical literature to medical practice, and which result in best possible patient care. So that is called the evidence-based medicine. Why this evidence-based medicine, need of this evidence-based medicine? Because as I already told you that there is a high degree of variations in medical practice. Despite, see, this statement I like too much, and I think it is applicable for everyone, that high degree of variations in medical practice, despite doctors being trained with the same curriculum. You all know that curriculum is same, syllabus is same, teachers are teaching everyone same, but the variations in medical practice. So now here the concept of evidence-based medicine is very, very, very important. Okay, because multiple drugs, rapid growth of drugs, but then also that's why the variations in medical practice. So evidence is must. Medical care getting more complex. You all know we were suffering, we were in dilemma that which drug is effective in COVID-19. That was a horrible conditions, a complex conditions and challenging job for the prescribers. So medical care getting more complex. Of course, now it becoming more expensive. So important to know the best possible care. And that's why the pharmacology subjects, I would say, the term is, because here you have to choose. You will train to choose the drug for the particular disease. There are so many drugs available in one group, but you have to choose as per some criteria, and that gives a best possible care. Okay, and of you not forget the cost-effective treatment. So this all, I mean, the statement which is related with the evidence medicine. The second competency which I have covered, that is evidence-based medicine. Another term which was given, that is a therapeutic drug. Understand in your pharmacodynamic class. What is therapeutic drug monitoring? Means there are certain drugs which is highly susceptible to cause toxic effect, and there you require to monitor its plasma concentration. So the monitoring of plasma concentrations, which can, it is called the therapeutic drug monitoring. Okay, two competencies. Now coming to the sources of drug. Let me just tell me which are the sources of drugs. I know that you must be having book in front of you, but can anyone tell me that which are the sources of drug with one example? You all know, I told you. Oh, it is already written here. Fine. Anyone? Chalo, Fari. Who is going to tell me? Yes, plants digoxin. Yes, Rutam, very well. Animal में से कौन सा होता है? Shivan. Rutam said plant से digoxin, animal से insulin. Rutam, yes, very good. Insulin. Fine. Okay, animal से insulin. Anyone? Other than plants and animals, glycoside is again okay, fine. Microbes. Which drug is developed from microbes? Anyone name some drugs? It is penicillin. Yes, said penicillin. Okay, just also said penicillin. Any other source? Mineral में से iron. Very good, very good. One more, streptokinase. Streptokinase किस में से होता है? Derived. Anyone? Okay, fine. Biotechnology. Yes. Okay. What response दे रहे हो? Very good. I like. Thank you. See, this question, please you all have to remember in detail. Again, I am telling you, can be in Viva short answer questions, maybe short note. So what are the various sources of drugs? Plant source, animal source, mineral source, human source, and microorganism. You all have described this, right? So these are the source of plant source. Somebody said digoxin. Can anyone tell me this is of what plant? देख के ही पता चल जाता है, everyone. शायद सबको पता होगा. ये कौन सा प्लांट हो सकता है जिसमें से ये देखो स्क्रैप करके आया है कुछ? पोपी प्लांट. यस, अक्षता, वेरी गुड. ओपियोइड. यस. Okay, so fine. Poppy. These are the some of the alkaloids, or you can say the drugs which are, so one is from the Atropa belladonna, the drug that is atropine. Remember just now the name of the drugs. The other plant which is called Rauwolfia serpentia, that is derived, means the reserpine is derived from that plant. You all know opium, Papaver somniferum, opioid, that is morphine is derived, and from ergot plant, ergotamine and methysergide. So at least one name and its source, plant source, you have to remember. Okay, so these are the drugs which are derived from plant. Glycoside said, you already mentioned digoxin and quaben. Digitalis purpura is the source and other is the Strophanthus gratus. So quaben, oaben, these are the drugs which are derived from the plants. Okay, so there are various plants and its origin is in different regions. Okay, need not to remember these, at least you remember the 5 or 6 drugs which I told you in my previous slide. Second mineral, you all know ferrous, derived from mineral. Then Lugol's iodine, that is also mineral source. Animal source, easy, one said insulin. Yes, the animal source is pork and beef. Okay, it is derived from pork and beef, but there are disadvantage of allergic reactions. So nowadays, insulin is not used which is derived from animal. Now it is used from the which is derived from the human source. Coming to the vaccines, all vaccines you all know: anti-rabies, anti-snake venom, anti-tetanus, anti-diphtheria. Now here vaccines also, it is a animal source, and some of the vitamin, you know, the liver extract, that is also vitamin B12, that is from liver extract. And there are 7C's tablet was there, the pearls was there which contain vitamin E. Sometimes that is a fish oil containing. So these are the animal source of the drugs. Okay, now human source. Human source, very good example or frequently remembering example is source is insulin, and the sources is, that is recombinant DNA technology. It is derived from the human and it is given in patients suffering from type 1 and type 2 diabetes mellitus. Microbes, antibiotics. Okay, so penicillin you all know. Cephalosporin is another name of antibiotics which is also derived from microbes. And there are n number of other drugs which are derived from microbes. So sources of drug, as per its sources, at least you all have to remember one or two name. The third objective is, the other objective is there are special or newer drug delivery system is there, or there are different drug formulation is there. Which are the name of these newer drug delivery systems or the formulations? What is drug delivery system or the drug delivery? Remember, it is different from the route of drug administration. So there are two terms which you have to understand properly. The first is drug delivery system or the drug delivery approach. And the second term which you all have to remember is route of drug administration. So just now I'm talking about the drug delivery approach. What is drug delivery approach is referred to the various approaches for delivering a pharmaceutical compounds. Okay. The term is various pharmaceutical compound in the human body which is delivered to achieve or to optimize the desired therapeutic effect. That is the the definition. And what is the other benefit? While minimizing its adverse effect. So one can reduce adverse effect by giving a pharmaceutical compound in human body, and the purpose is to achieve or to optimize the desired therapeutic effect. But remember that all what I am going to discuss is in this, they are not available all the time, and especially in India. Here you require to apply your knowledge, the theoretical knowledge, and in future there is may possibility due to rapid growth, it may happen in India. So what are the examples of this newer drug delivery system? The first pharmaceutical compound, you can say the name is Occusert. The name it suggests, Occusert. What is Occusert means? These compound or these formulation is capped beneath the lower eyelid. Oh, these are so-called modern drug delivery system. And here only the single application release the drug for 1 week. Now, in which type of disease this compound can be used? There is one of the ophthalmic conditions which is called glaucoma. And in glaucoma, there is one drug you will come across during the further classes. That is, one drug is called pilocarpine. Now, this pilocarpine has some mechanism of actions and basis which can help in glaucoma. So there are drops available of pilocarpine. That is a simple drug delivery. But there are modern delivery systems also there, and that compound is called Occusert. So here you can label it as a new drug delivery system. Then Progestat. Progestasert, that is intrauterine contraceptive device. You all know that it is available, which release progesterone for 1 year. So that is also called a newer drug delivery system. Then the other compound available, it is labeled as a liposomes. What is this liposomes? That here in liposomes, drug incorporated in minutely phospholipid vesicles. And the applications will be different. For you, you have to remember that which drug is available in this type of drug delivery, amphotericin. If you remember, in last year, there was a mucormycosis, a patient of mucormycosis after COVID infection. And there this drug was used, amphotericin. It is one of the antifungal drugs. It is available in a liposome formulations. Okay, so remember the drug and its purpose. The another newer drug delivery, and it is available, that is monoclonal antibody. You can say that monoclonal antibodies, they are preferred in many autoimmune disorders and in various diseases where the other drug formulations will not help. Okay. So in monoclonal antibodies, immunoglobulin will react with this specific antigen, and these monoclonal antibody they used for so-called targeted delivery. So here, what is that? It is a smart drug delivery medications to a patient in a manner that it increase the concentrations of medications in some part of the body. So there is a some part which is targeted, and where there these monoclonal antibody can help. Okay. So most especially anti-cancerous drugs, they are available in this type of formulations. Then coated implanted devices are available, and these coated implantable devices, what is their function? The drug will release the stents. I mean, the drug releasing stents is available, and there is some metallic stents. You all know now it is very common. Here I have written the one of the immunosuppressant drug, that is a sirolimus. So here the drug will release slowly. Okay, but that is specially available in that device, or you can say that is available in a stent. So for you people, you have to remember some of the name of the formulations. Then there are some of the formulations which is given by subcutaneous route. Okay, so the at least the route you have to remember the use of this subcutaneous route for particular pharmacological compound. They are called, one is dermojet, second is pellet implantations. So these dermojets has to be given in a by subcutaneous route. It is a painless, and there are various drugs available. Just remember the drug delivery formulations. The other is available in a pellet implantation, and the last is insulin pump is also available. So can be infused subcutaneously. I mean, it is given in subcutaneously, and there will be continuous subcutaneous infusion will be there of insulin. Only the advantage is daily administrations of insulin is not required. But there are always the disadvantage, because monitoring of blood sugar is very important if you use these certain monitoring devices. So it is just the knowledge part where you have to remember that these type of drug formulations, drug delivery formulations are available. Fine. So till now I have discussed some of the, the 2 or 3 definitions. Then I have discussed the historical part, sources of drug, and the last portion is newer drug delivery formulations. So these 4 points I have covered. Now coming to the route of drug administration. I think I will give you 10 minutes, and then you all have to join again. The link will be remain open. But let me tell you something about the route of drug administrations before taking break. Route of drug administration. Yes, somebody said, Rusil said he has some doubt. Yes, Rusil?
Ma'am, can I mute myself? Ma'am.
Mute? Why? Unmute or mute?
Ma'am, unmute.
Okay.
Unmute.
Yeah, I can hear you.
Ma'am, my question is that in the drug delivery system, ma'am, in that one drug is already given, and after that these drugs are given?
No. Yes, good question. See, first slide I told you that dose is very important. Okay. So you cannot choose that. Suppose if you have given drug in a general route or whatever the standard applications is available, and then if you want to choose the other newer drug delivery system, then here the therapeutic drug monitoring or drug dose is very important. So either this way or either this way. Only when you choose any drug delivery formulations or any route, whatever the drug, one has to apply the rational therapy, means the dose. So if I mean that you cannot give two formulations to give, the together, or you cannot increase the dose also. Rushil, am I right, beta? What do you want to say?
Yes, ma'am. Ma'am,
Can you
but
just tell me one of the
I
example
wanna
of these formulations, what I discussed, and then I can give you answer. See, talking about insulin pump. Rusil? Yeah. Tell me.
examples. Accused.
Yes. I think your voice is breaking somewhere.
Yes, ma'am. Now it's audible.
Yes, now it is clear. Yes.
Ma'am, Occusert, then Progestat, liposomes, monoclonal antibodies.
See, let me tell you. Okay, let me give you one practical example. See, there is a patient of glaucoma. Okay.
Yes, ma'am.
Okay. Now there are various types of glaucoma as per onset, acute or chronic. Suppose if
Yes.
you say that in acute glaucoma, a drug of choice is pilocarpine, or in chronic glaucoma. Just now, I'm not going to go detail, but suppose a drug of choice is pilocarpine. Now, if you have started pilocarpine in a drop manner, drop means eye drops is available. Okay, that is one of the dosage form. Can you understand, Rusil?
Yes, ma'am.
So it is available in a eye drop and it is available in a Occusert. Now, if you want to give these drug in a drug formulations of Occusert, then there is no need to give drop, eye drops.
Okay. Yes, ma'am.
And the main point, please remember here, before I talked about these formulations, I told you that each formulation is, every formulation is not available. That is the first thing. And second thing is you have to see the cost benefit. These newer drug formulation is too costly. So rational drug therapy, one of the important criteria is cost effectiveness. So if you think that patient is affordable, that formulation is available, and patient has given consent, then you can start either the newer drug formulations or maybe the older one.
Yes, ma'am.
Right?
Clear.
Yeah,
Yes.
am I satisfied your answer?
Yes,
Question? Fine?
Yes.
Okay.
Yes.
Coming to the route of drug administration. Now, okay, chalo, let me ask you, by which route you can give drugs? Fatafat, you can write in chat box because it is a very easy question. I will see that who are going to give me answer. Which are the routes available? Oral, intravenous, okay, intramuscular, subcutaneous, sublingual. Yes. Common आ गया. अभी one more intramuscular आ गया. Muscular, nasal, rectal. Very good. Yes. Intradermal. Wow. Inhalations. Because book is there in front of you all. Rectal. Yes. Okay. Fine. Happy. So there are various routes of drug administrations, and by which you can administer the drug. What is route of drug administrations? I would like to explain this, as I told you that formulation is different, drug formulation, and route is different. So route of drug administration is the path by which drug, fluid, poison or other substance, please understand, is brought into contact with the body. The term is brought into contact with the body. You all said that oral है, intradermal है, rectal है, but one more route is topical. Okay. When you apply anything by the immune scheme or mucous membrane, that is one of the route. So whenever there is a drug or any poison or it comes into contact with your body, that becomes the route of drug administration. So there are classifications. What are the classifications of the route of drug administration? Can be divided oral route, can be of parenteral route, and it can be of topical route, can be of rectal route, and can be of inhalational route. So, as such, there are 5 routes by which drug can be given. So oral, that is usually given for the systemic effect. Now understand these two terms, local effect as well as the systemic effect. So when you give drug orally, it is used for the systemic effect, and substance is given via digestive tract. And parenteral, pronounced like that, parenteral, no, par, which is in this a drug injected via needle into the body, and it will vary at various side and into various depth, because intravenous and intradermal subcutaneous, they all are considered here parenteral. So what is par? Par means beyond, and enteral means intestinal. When you are giving drug beyond the intestine, that is called, or in an injectable form, it is called parenteral route. Okay, the second route is parenteral. Third, as I told you, topical. Here, I told you drug can be given topically to the skin, directly applied like the skin, or maybe through mucous membrane. Mucous membrane, especially, you can say available as a eye drop, eye ointment, ear drop, ear ointment, nasal drop. Okay, there are nasal sprays available. Suppositories are available. They all are come in contact with the mucous membrane and skin, so they are considered the topical preparations. The other route is the rectal. You also said when you drug in the form of suppository or any through rectal route, then in rectum, then it is called the rectal route. And the other route is inhalational route. Here, the lungs provide surface for absorption. So whenever you give the drugs, it will, here the main organ important is lung, where the lung will have the absorption of the drugs, and which has to be delivered in a gaseous form, can be in a aerosol form, or can be in a ultra-fine solid particle form. So whatever the substance we are giving to inhalational, they are in the form of gas, in the form of aerosol, and in the form of ultra-fine solid particle. Okay. So this is about the overall route. I told you in my objective that there are certain factors, or there are certain important points, characteristics which decide the route of drug administration. Essentially, that any drug you give by oral route, or any drug you can give by parenteral or topical. There are certain factors which determine the route of drug administration. So, which are that factors? The first factor is drug factor is that. So, here you have to see the physical property of the drug. What is the nature of the drug? I will decide SDD, basic, depends on its its physical property, be of a solid or liquid. Then again, very important drug factor is pharmacokinetics. What is pharmacokinetics? Anyone can that? Pharmacokinetics is one. Anyone would like to say? Unmute yourself. What body does the drug? No, mechanism of drugs comes under the, yes, mechanism comes under the dynamic. Yes, what body does the drug? Means यहाँ क्या है? Body को important है कि अपने drug कैसे, how it help or process, I mean proceed. So pharmacokinetics is also important by studying those. It's plasma of light. Every drug has its plasma of light. जहाँ once it enters into the body, its plasma constitution become half. और कितने hours में ये half होता है? That also important for the pesticide the root. And the last is one has to see its profile of toxicity. So drug factor is important for the determination of root. The second is patient factor itself. You have to see the condition of patient. What are the associated diseases? Convenience of the patient is very important. Now this is the practice that some of the patients will say, so that would be the convenience of the patient, but you have to see again the cost and the rationality, and one has to see the age. So patient factor, it is a condition, comorbid condition, the associated diseases, patient compliance or convenience, and the age. And the other factor is disease factor. And you all know that in emergency, if you give anything orally, the oral drugs will be declining well. Whereas if you give something directly in the blood, of course it will act faster than oral. So one has to see the emergency conditions and by I mean which action you require particular local action or you require the systemic action. So these are the factors which determine the route of drug administration. Okay. What is the clinical indication to understand these routes of drug administration? Because the drug may produce different effects by different routes. You know, somebody he has asked me the route or the formulation. Here you apply the concept that one drug has many actions, maybe more than 3 actions, and will act its action may differ as per the route. So that is also very important. See, here I have an example, that magnesium sulfate. The substance if you give topically, that for the localized edema, it will act as a hydrotropic action, as a hydrotropic. But if you give magnesium sulfate orally, it will help in the treatment of concentration. I mean, just to remember, if you give these examples and then discuss later on many examples, if you give parallelly these drugs, that will be for tachycardia and serotonin. So here the thing is route change, its indication change. So drug factor is very important to determine the route. Okay, I think now I will give you 10 minutes break. What is the time just now? 10:41. So what time we will be back? 10:45. Is it fine, everyone? In my watch it is 10:45. 41. So we'll come back 10:45. Is it fine? Somebody please write yes, no. It gives me cool stuff. Yes. Cool, ma'am. Yeah. Fine. Yes. Very good. Chalo. Okay. So we'll be at 10:45. In my watch it is 10:41. So only I'm busy. We will be there. I'm switching off my voice as well as the audio video.